Hello, my name is Emily Heerema-Smith, and I'm an occupational therapist at Shore Rehab Institute.
My name is Janice Neilan, and I am a physical therapist at Shore Rehabilitation Institute.
And today we're discussing our stroke education series, and today's topic is, what is a stroke? A stroke is a brain injury that occurs when the brain's blood supply is interrupted. Without oxygen and nutrients from blood, brain tissues quickly die within minutes, which results in a sudden loss of brain function such as the ability to speak, the ability to move an arm or a leg, loss of vision, loss of balance. And other common names for stroke are brain attack, cerebrovascular accident or CVA, cerebral infarct, or infarction.
Some of the warning signs of a stroke. The most common signs and symptoms of a stroke are sudden weakness or numbness of the face, arm, or leg, especially on one side of the body, confusion or difficulty speaking or understanding, sudden problems with vision such as dimness or loss of vision in one or both eyes, sudden dizziness or problems with balance or coordination, sudden problems with movement or walking, sudden severe headaches with no other known cause. Other less common symptoms of stroke may include the following: nausea, vomiting, or fever not caused by a viral illness, brief loss or change of consciousness such as fainting, confusion, seizures, or coma.
An easy way to remember the signs and symptoms of a stroke are an acronym developed by the American Stroke Association, B FAST. B standing for balance. Maybe you've had a sudden loss of balance or you don't really feel yourself in space. E for eyes, loss of vision in one or both eyes. Your face, the face is uneven, it's difficult to smile or move your mouth. Arms, one side of the body, including the arm or leg, could be weakness, or maybe the arm is hanging down. Speech, your speech is difficult to understand, or it's difficult to understand someone else, or maybe you seem confused. And T is the most important one, time. Please call 911 right away if you feel you're experiencing any of these symptoms.
Some of the risk factors of a stroke are things that you cannot change or manage, whereas others you can change or manage. Some of the things that you cannot change are your age, your genetics, your previous medical history, also if you've had a stroke before, and your race. Things you can change or manage are high blood pressure, diabetes, heart disease, atrial fibrillation or AFib, high red blood cell count or high platelet count, high blood cholesterol or lipids, obesity, excessive alcohol use, sedentary lifestyle, sleep apnea, or high levels of stress.
Types of stroke include ischemic stroke, hemorrhagic stroke, and TIA, which are called transient ischemic attacks.
The ischemic stroke is a type of stroke that occurs when a blood flow to the brain becomes blocked. When the lack of oxygen or blood goes on for too long, tissues die, which will cause ischemia. Approximately 85% of strokes that occur are ischemic strokes.
Hemorrhagic strokes occur when a blood vessel in the brain breaks and bleeds into or around the brain tissue without any prior trauma or injury to the head. It is estimated that about 15% of strokes are hemorrhagic strokes.
Transient ischemic attacks, or TIAs. TIAs, also referred to as mini strokes, are brief moments of lack of blood flow to the brain. They are reversible and can present mild symptoms similar to those of a stroke. TIAs usually last less than 15 to 20 minutes, but can be as quick as 5 minutes. Although TIAs are short, they are normally a warning sign that a major stroke is about to occur. There is no way to know if you're having a TIA or a major stroke when symptoms begin without brain tests such as an MRI.
To prevent strokes, there's many things that we can do, such as diet and exercise, including programs given to you by your therapist, medication management and managing your atrial fibrillation, sleep management, stress relief, smoking cessation, blood pressure management, and diabetic management and blood sugar management.
In conclusion, you can take an active part in stroke prevention. Reach out to your case manager for any questions on how to schedule a training with your therapist.
Thank you.